The Brown Adult Reconstruction Fellowship is a wonderful comprehensive program that really gives the fellow experiences and all approaches to the hip. We have hip faculty experts and anterior approach, anterolateral approach, and posterior approach. We also have surgeons that do gap balancing total knees and measure resection total knees, so you really get the whole gamut of primary hip and knee replacements. I was the first fellow in the program, and this fellowship program is really important to me. As a result of that, I got to go through the process and benefit from the great education that's here, and to come back was really a privilege. And my goal and the rest of the team's goal is really to keep that going.
The fellowship right now is with our 5th fellow, so it's now very regimented, very worked out, the details. So the interest in doing the fellowship dates back many years before that, but we really felt that we wanted to have a critical faculty number and volume so that both the residents and the fellows would feel that they were getting optimal education. So there's a significant breadth now to the program, both in terms of depth of faculty as well as sites of surgery as well as volume of surgery.
I think the exposure here is outstanding. I think it's a really wide gamut of and very variable arthroplasty cases, from infection to severe osteolysis.
Research lab is probably one of the top funded lab in terms of cartilage research, in terms of some of the new technologies on osteoarthritis. There's a lot of research looking in infection in total joints and infection orthopedics in general. And I think most of our faculty spend time in the lab.
We actually have now 6 full-time members in the division, and our fellows routinely do upwards of 600 plus cases per year.
It's kind of a unique setup. It really has everything that you could want from a training perspective. You know, they do all 3 approaches to the hip, the prosthetic fractures and infections that might come to like Rhode Island Hospital versus the bread and butter kind of community hospital total joints experience. From a joints perspective, you're going to be comfortable with.
Being kind of a referral center in the state means that not just in the emergency room, but even within our offices, we're seeing these challenging cases frequently, and I think that boils down for the fellow experience. The fellow really gets their pick of the cases every week, and make sure that by the time that year has wrapped up, they've seen a huge broad variation in different very challenging arthroplasty cases.
The fellow is really treated as a colleague and an integral part of the team. We look as a fellow as a junior partner that we're trying to help learn and mold. It's not someone just to do work for us. We're really here for their education, and so we treat them that way, and I think as a result we take great pride in their growth throughout the year.
It's been a good experience, and we have weekly indications kind of meetings, grand rounds. We have visiting professors all the time that come through and bring different expertise and backgrounds. They also get to see our own process, and the benefit of it is then you get input on how to optimize and improve and really expand. I think a lot of residents look at the Brown Adult Reconstruction Fellowship due to its diversity, due to its Ivy League background, as well as the true educational experience that we offer. Nowhere else in the country you can get what you get at Brown.
What brings us together is we have a weekly indications conference, and so every week we all discuss complex cases that come in, and it's the absolute best thing for the fellow because in a short period of time they can hear all these different opinions by all these fellowship trained surgeons that they can share what they've learned from their experience and their training. That conference is a really valuable experience for all of us. I enjoy the conferences. I think it's a lot of fun.
It's exceeded expectations, and I honestly had set the bar pretty high. I have my own clinic, so I get to book my own cases and have that autonomy that I want.
We are one of the first groups in the region to really transition to outpatient total joints. The fellows are able to participate, see the whole flow from patients being set up in the office beforehand, seeing how we approach the actual surgical day, where you have a close cooperation with anesthesia, the nurses, the physical therapists in order to really make the program successful.
I think Rhode Island's the best place to do a fellowship. You have the beautiful beaches close by, wherever you're at in Rhode Island. They're 15, 20 minutes away. You have great sports teams locally, such as the Providence Bruins, and then the teams in Boston that you can go to a game.
When I think of bringing up my kids, I think it was wonderful having proximity to Boston or to New York.
Those are things that I like. I grew up, in New York, and I lived in New York City before this, so that was something that I was looking for, and Providence has really lived up to that.
So you're not only working closely with attendings, but you have the opportunity to take the skills that you learn and practice with appropriate supervision. And so you get to run your own fellows clinic, also do your own cases with appropriate supervision as well. So the goal really at the end of this fellowship is that you've really worked out all the kinks. So when you go out into practice, you're really going to be a rock star.